This What's Working with Cam Marston podcast is brought to you courtesy of Michelob Ultra Beer.
They say consistency is the key to success. They weren't wrong. So how about grabbing a beer that's consistently smooth, consistently refreshing, and consistently light? You might just find that the road to success can be pretty enjoyable. Michelob Ultra, the perfect balance of taste and refreshment, and only 2.6 carbs and 95 calories. It's only worth it if you enjoy it. Enjoy responsibly. Anheuser-Busch Michelob Ultra Light Beer, St. Louis, Missouri.
Welcome, everyone, to another episode of What's Working. I'm Cam Marston. Glad to have you on for the ride. This is the show focusing on the workplace, the workforce, and the marketplace trends that are shaping and changing the workplace, the workforce, and the marketplace around us. I try to find people who can answer questions that when they answer those questions, you and I will get some insight, and their insights will help us get a little bit better at whatever it is that we do. Again, welcome. I'm glad to have you on for the ride. If you ever want to reach out to the show, you've got a guest idea, you've got a question for me, you want more information, I'm going to go ahead and leave this in segment 1. I usually do this in segment 5 of the show. Reach out to me. My email is cam, C-A-M, at cammarston.com. The website is cammarston.com. And on that website, you can find all the shows we've recorded in the past. We're up to 220-something, I think. And there's something you want to hear again or a show that you've heard and you want to send to a buddy of yours and say, hey, you need to listen to this one. You can find them at cammarston.com. Go under the broadcast media link. You'll find the link to What's Working with Cam Marston, and there you can find both the current show as well as the inventory of the previous shows, and I hope you will do so. All these shows, by the way, are available on your favorite podcast app. And if you decide to go download them or listen to them on one of your podcast apps, please, if you get the opportunity, rate the show. Those ratings really matter. Again, welcome to What's Working. Proud to be broadcast across the state of Alabama, Huntsville, Birmingham, Montgomery, and the home station of Mobile. One of the big expenses in most workplaces is health insurance. For those that offer health insurance, they can talk about this. It's an extraordinary expense that employers pay. I am not just a small business myself, but a very small business, and it is a noticeable amount that I write to cover myself and my family once a month, and would love to find a way to reduce that. The state of Alabama, we've got one major insurer, the 800-pound gorilla on the corner, and that is Blue Cross Blue Shield, and they have they run the market essentially, and there certainly are other insurers available for employers, but they're the ones that kind of set the pace, set the tone for those of us employing in the state of Alabama. Then I sat down next to a man named Mike Molyneaux. And Mike and I met each other at one of our succession planning events that we've advertised on this show. This is his second startup, the one that I'm about to introduce to you when we come back from break. And he is trained as a physical therapist. I never was clear with Mike in the time that we spoke whether he's practiced physical therapy. He continues to keep his license, but he just seems to have this uncanny ability to identify market niches, market availability, and quickly go in and fill the niche with a product or a service. And what he's created, which we'll get into after the break, is an opportunity for employers out there that self-insure for health insurance. And he's grown it just like he did his previous business, growing it very quickly. And when we come back from break, Mike's going to tell us about how the business was created, what niche he fills, where and how he identified the niche, and where he sees it going in the future. He's a soft-spoken yet confident man. You wouldn't ever question the things he says because he says it with absolute authority and humility at the same time. I think you're going to like Mike as much as I did, and you're certainly going to respect and admire the way he's filled this niche that he's identified with yet his second startup that is growing very, very quickly throughout the state of Alabama. And as he'll say, or tell us in a little bit, I think he's going to move into Tennessee before too long. Love to have the guy. Grateful to have made the connection. You're listening to What's Working. When we come back from break, Mike Molyneaux and I will be on talking about his program for self-funded healthcare programs in companies across the state. He'll tell us a little bit more, clarify that when we get him back. Before we go to break, I want to talk about the professionals at Sandifer Wealth Management, CFPs, which stands for Certified Financial Planners, must meet rigorous educational, ethical, and experiential standards in order to be considered a CFP. Planning properly will drive the results that you're looking for in your savings and investments. Sandifer Wealth Management has 2 certified financial planners, both Jamie Sandifer and Mark Salyers. Visit their website at sandiferwealthmanagement.com. They're based here in Mobile, can do business at any part of the state of Alabama. CFP is a very important designation, and if you're going to find a wealth planner, a financial planner, I would encourage you to make sure that CFP designation is attached to their name. Both Jamie and Mark have it. Worth starting out with those 2. When we come back, Mike Molyneaux, you're listening to What's Working. I'm Cam Marston. What's Working is brought to you by the Alabama Center for Real Estate, housed in the Culverhouse College of Business at the University of Alabama.
Back in 64, that's when Keith Air Conditioning opened their doors.
In my family, turn to the experts is more than a tagline. It's a promise. Every Keith technician is an experienced AC professional, and that saves you money. Speaking of money, how about 0% financing for up to 60 months on installations of new Carrier systems? Keith and Carrier, turn to the experts.
Mobile's leading name in comfort since 1964.
License number 83731.
Customer service never goes out of style. In fact, I think it's safe to say that customer service is more valuable and more important now more than ever. Hi, this is Cam Marston. One thing that my over 200 episodes of What's Working has taught me is how important customer service is to building and maintaining a thriving business. It's the growing need for customer service that's led me to partner with one of the state's leading customer service trainers to create our program called Delivering 5-Star Customer Service. Your team will get one 90-minute training session per month for 6 consecutive months. Each session builds on the skills learned the previous month, allowing your customer-facing teams to practice before moving on to the next lesson. And the 6 lessons address everything from appearance to electronic communications to conflict resolution to maintaining a service mindset. Our program travels and is delivered in person at your workplace, nothing virtual. You simply can't practice the level of the skills this course teaches virtually. For more information, email me, cam@cammarston.com, and let's schedule a time to talk. Remember, you have less to fear from outside competition than you do from discourtesy and bad service from inside your own company. Again, email me, cam@cammarston.com, and let's talk about your business. You're listening to What's Working. I'm Cam Marston. We're back. What's Working is brought to you by the Alabama Center for Real Estate, housed in the Culverhouse College of Business, all housed at the University of Alabama. I'm in the studio today with Mike Molyneaux. He's the president and CEO of Symbol Health Solutions. I met him at our succession planning event several months ago, I guess it was now, and heard a little bit about his business and the disruptive model that he's created, which made me really want to get him on the show to have him explain this. So we're going to get into the weeds with Mike here. But before we begin, Mike, thank you for your time. Welcome to What's Working.
Thanks for having me, Cam. Glad to be here.
I'm glad you're here, too. It took us some effort to get us on the calendar. 2 busy people, here we are. So quick highlight of his bio. Mike is the CEO with a vision of science-based on-site healthcare. Prior to creating Symbol Health Solution, he co-founded and successfully led one of the largest rehabilitation outpatient clinic contract companies in the country for over 20 years. And I'll pick up more of your bio as we go along. First, Mike, tell us from a 60,000-foot point of view, what is Symbol Health Solutions?
Great. Well, thank you for asking. Symbol Health, we call it Symbol for short. Symbol is a regional provider of on-site primary care clinics for employers who have self-funded health insurance plans. And by self-funded, I mean that they're self-insured. So they don't buy their insurance from Blue Cross or Aetna or Cigna. They self-insure, and then they do end up buying what they call a stop loss, which is a high deductible to take care of catastrophic claims.
And you manage the health for the primary care for the employees of that organization, as I understand it, on site for them.
Yeah, it's on site. So what we do is we will build a clinic on site, sometimes near site, depending, and sometimes it's a shared site if there are more than one employers that want to participate. And we provide the services, which is acute care, primary care, episodic care, urgent care, preventive care, and we also dispense medications on site. It's free to the employee, and so an employee or a member of their family that's on the health plan can walk into the clinic, be treated by the medical provider, a doctor or a physician extender. There's no waiting, usually no waiting. You get 20 to 30 minutes allocated for each appointment, and you walk out with your prescription in your hand. And then what we do, instead of filing a claim for it, we bill it back to the employer directly at a greatly reduced price.
What did you see? So you had 20 years, if I read this correctly, 20 years in the healthcare business prior to this. What did you see in the marketplace that you said, ooh, I think I see an opportunity here? How did you read those tea leaves?
Well, actually, what I saw was that every year as an employer myself, I had over 1,500 employees with a company that I co-founded with my roommate in college. We ran it for 20 years and it became a national company. And before we became self-funded ourselves, we found that each year, we were faced, after we became self-funded, when you can direct your own health plan when you're paying for it yourself, we found that there were basically only 3 options out there for an employer to make insurance and health care affordable to his employees. So each year we would look at what we spent the year before and we said, oh my goodness, we got to do something. So there were 3 options. You could either reduce the benefit, or eliminate a particular benefit. You could adjust the copays, or third thing you could do is just raise the premiums. And those are the only 3 options really for a lot of employers even today. But none of those 3 really did anything for the underlying problem. And the underlying problem is the ongoing, unmanaged chronic disease management. People with diabetes and people with hypertension, and there was nothing being done to attack the problem. We were only attacking the symptoms.
So if I understand you correctly, you're saying that these underlying problems were driving most of the cost of the health care you were paying as an employer to your 1,500 people.
And still do to a very large degree throughout the industry.
So is it safe to say that of your 1,500 people back in the day, and I'm going to make something up, 80% of them didn't need much health care, but 20% of them with the underlying problems were the ones driving the premium that were needed to be addressed?
Very intuitive of you. That is exactly right. And that still holds true.
The 80-20 rule always works.
Yeah. And so what we decided to do, let's do something about the problem. Let's give patients, in this case, employers and their employees, and other members of the health plan, like the spouses and their children, let's give them ready access, immediate access to primary care, and offer disease management. And there's a lot of ways that can be accomplished these days. And then offer programs that produce lifestyle intervention, like health and wellness programs, And so that's how we formed our model.
So you formed your model. Did you use your model on your own company, the 1,500-person company, or did you form the model and then take it into the marketplace?
No, this came after I exited the rehab company, and my background, of course, I was trained as a physical therapist. I continue to hold my license even to today. I may be a little rusty, so I could hurt you today. But at one point, I was pretty good at it. But so I've been around health and wellness and fitness, and have run fitness centers and in hospitals, all medically based fitness centers for a long time. And I got into Symbol originally. I started it as a health coaching company.
Oh, really?
So
it was never intended to be an alternative to a self-infunded health plan, but it was a chronic disease coaching company.
It was a chronic disease coaching company, and then I saw the demand. I saw it came to me that we really need to do something disruptive, something that people, some of it was my own ideas, some of it came from ideas that I saw being done around the country, and so we created Symbol as that vehicle.
How old is Symbol?
We've been in business for 13 years now.
Tell me about the first sale.
Interesting. The first sale, well, the entry to a customer. The clinic is considered a benefit. Actually, a clinic is considered a health plan, and benefits are sold to self-funded and actually fully insured companies as well through benefit brokers. Willis Towers Watson, Cobb's, Aon, which is a really big one, Mercer. More locally, Cobb's Allen out of Birmingham, Valiant out of Birmingham. So these benefit brokers sell these benefits to the company through HR, and so some benefit broker had heard of us and liked our model, liked what I was trying to achieve, and they want to sell it for us. Well, I mean, for my previous company, which was called TMS. Yours truly and my roommate from college, we did all the selling.
Yeah,
we did it all ourselves, and so. But they said, no, just send me a contract, and we're going to go up there and talk to them about it. And it was kind of interesting because I'd never done that before. And when I walked into the first meeting, it was a steel manufacturing company up in Birmingham. I walked into the first meeting with them, and I came prepared for my presentation, and the contract was sitting out there on the table, and the first thing I know is the guy says, well, okay, I'm good. He signed the contract. When can you guys start? So our first sale came through a benefit broker.
Do they continue to come through benefit brokers?
Probably 50%.
Really?
Yeah, about half of them do.
What is your marketplace?
Our market, well, right now, all of our clinics are in Alabama. We're getting ready to expand into Tennessee and Georgia, probably in Q3 of this year. But the marketplace is any company with that it has a self-funded health insurance plan.
Yeah,
it doesn't work if you're fully insured because there's no savings.
Yeah,
there's no savings because it would really be like an extra expense.
Let's when we come back from break, let's talk about where this is going. So we've heard a little bit about the story, but where do you see this going? This disruptive model at some point may be disrupted itself, and will you disrupt your own model? Let's talk about your vision from the future when we get back. I'm sitting here with Michael Molyneaux. He's the president and CEO of Symbol Health Solutions, more commonly known as Symbol. When we come back from break, we'll pick it up. You're listening to What's Working. I'm Cam Marston. It's brought to you by the Alabama Center for Real Estate, Culverhouse College of Business, University of Alabama.
They say consistency is the key to success. They weren't wrong. So how about grabbing a beer that's consistently smooth, consistently refreshing, and consistently light? You might just find that the road to success can be pretty enjoyable. Michelob Ultra, the perfect balance of taste and refreshment, and only 2.6 carbs and 95 calories. It's only worth it if you enjoy it. Enjoy responsibly. Anheuser-Busch Michelob Ultra Light Beer, St. Louis, Missouri.
We're back. I'm Cam Marston. You're listening to What's Working. What's Working is brought to you by the Alabama Center for Real Estate at the Culverhouse College of Business, all housed at the University of Alabama. Mike Molyneaux is the president and CEO of Symbol Health Solutions. It's his second business, the first one he founded, as I learned a moment ago, with his college roommate. He is a licensed physical therapist that hasn't laid hands on a patient in a long time, nevertheless maintains that license. Self-funded healthcare is the market that you're in. It's a disruptive market. You're knocking some people around. That's the way I think of self-funded, or that's rather the way I think of disruptive. Tell me what the future looks like as you grow and expand the business throughout Alabama, continue to grow it throughout Alabama and next into Tennessee.
Sure. Okay. So what we've done is created a model where we are bypassing the typical, if you come to our clinic, there's no claim made. There's no claim to be processed. So the third-party administrator of the self-funded health plan, and by the way, in Alabama, about 95% of companies have Blue Cross, either self-insured through them, and to my knowledge, they're really the only third-party administrator for self-funded plans. So in our model, we don't buy our drugs from Walgreens. We buy prepackaged generic medications that are dispensed on site. So really, we've kind of cut out Walgreens. We bypass Blue Cross because there's no need for a claim, and we're billing that directly back to the customer at probably half what they would pay through normal retail avenues. So we're expanding that now into other things as a result of the same sort of demand. We started out by doing imaging. So we would go to a local hospital and say, hey, listen, would you be willing to give us a discount off what you're charging, through Blue Cross? Give us a discount, waive the copay for the people that we send, and in return, what I'll do is you can direct bill us. We'll pay you in 10 days, okay, and then pass it back through to the customer. So we started with imaging probably 10 or 12 years ago. And from that, we went to maybe physical therapy. So we did the same thing with physical therapy. We're now expanding into any and all medical services. It could be orthopedic surgery. It could be dentistry.
Pregnancies?
OBGYN. It could be any medical service, inpatient services, outpatient services. So what you would do is you would go to the provider, the medical provider, whether that be a doctor or a hospital or an outpatient center, and you would say, hey, listen, we will guide our patients that come to our clinic to your facility. Of course, it's completely voluntary. They don't have to go there.
The patient doesn't have to go.
Patient doesn't have. They can keep their own doctor. They keep their insurance plan. But if they go here, then you agree to give us a discount. Okay. Usually it's Medicare plus a certain percentage. Medicare being the lowest payer.
Right.
And you give us a discount. You waive the copays. No deductibles apply. And in return, we will direct patients to you, and so you'll get the volume, okay, and you can direct bill us, and we'll pay you within 10 days.
So I know these hospitals, I struggle to get their reimbursements. They struggle with their own, collections. One of the values you offer is, hey, we're going to send you money in 10 days.
10 days.
Yeah.
10 days. I mean, that's the promise. Of course, there's always hiccups, but 10 days is the goal. So we have a team that is out negotiating contracts with providers as we speak, and we've actually launched this up in Birmingham. the company I partnered with has launched this with the Mercedes plant up in Tuscaloosa, and it's been very, very successful there.
Are the hospitals now clamoring for your business because of the features that you offer? Do they say, hey, this 10-day turnaround payment time is just precious for us. How do we get in on this? Have you become so large that the people you're trying to sell are now approaching you to try to buy?
No, we're not there yet.
Yeah.
I mean, so we only have, we don't have every company who's got a self-funded health plan is not one of my customers.
Yeah.
But it's a no-brainer for the hospital. We've never had a hospital say no thanks because it doesn't cost them anything. There's no obligation. Okay, and you only pay we only pay as services are provided. Very similar to Symbol's model. With Symbol, when we go in and put a on-site primary care clinic, the only cost to the employer is just the actual physical space.
Right, the square footage.
And they pay as they go. They pay only for the services that they use. There are no management fees. And you add all that up, the medications, and they pay for the visits as they go. They pay for supplies and all that sort of thing. You add all that up, and it comes to about probably half what they're currently spending.
Wow!
So it's a no-brainer.
So, what is the profile of a self-funded healthcare organization? Are these usually family-owned? Are they, To
me, no. We have we've had publicly traded companies who have used us. We have privately owned companies. We have a lot of municipalities that use us. For instance, Baldwin County, City of Fairhope, we have a client for them, a City of Gulf Shores. I mean, so we have municipalities. It used to be you would have to be of a certain size to go self-insured. Mm-hmm. Now what has happened, there's a model where they can take we have one company that has 60 employees and they're self-insured, and they form a pool. And they call it a captive. They form themselves a pool, and they get together to buy services. Such and on-site clinic is one of those services.
Do you see companies, smaller companies, let's say 30 people companies, combining together? Let's say I had 5 friends, each of us had a company with 30 people in it, and we all pool together and say, hey, let's self-fund and we'll work together to make this happen.
Maybe. I mean,
hadn't happened yet.
Well, it's not really my area of expertise forming these captives.
Yeah.
That would be a question, for a benefit broker firm. They'd be a lot better resource for that information. But I would have never thought in a million years that I would see a company with 60 employees go self-insured.
Yeah, that's small.
Yeah. Well, when we went self-insured the first time, we didn't take the risk, as you might call it, until we had 750 employees.
Wow.
Yeah.
It's a big difference between 60 and 750.
Yeah.
So these self-insured companies that are your customers now, what is the average employee number? Are they all 750 or greater?
Average? Well...
You got one outlier at 60.
Well, one outlier with 4,000. They can be any. There's not really an average.
Right.
I mean, our average is probably 800.
Yeah.
Probably for us, but for other companies, I mean, we're not the biggest company out there.
Yeah. So your days are spent trying to attract new self-funded healthcare organizations to your model. Part of your days or part of your team's days are spent approaching the health services providers to negotiate these contracts that sound like a no-brainer. Give me a profile of what your day looks like. You're the CEO of this organization. It's growing. You're moving into Tennessee. What do you do every day?
Well, my main concern every day is the care that's being given. With a medical background, I'm a patient advocate, and I'm really you mentioned earlier science-based primary care is what we provide. Is really more like evidence-based. We make sure that any service that we're providing, we keep up with the science. There's evidence behind it. We don't use medications or provide treatments unless there's been basically a double-blind study that's been published in a peer-reviewed journal. I mean, so I spend most of my day on things that happen within our clinic and ways to make it easier, ways to make it better, and dealing with our customers and their concerns. And then there's the business to run, not having a business background. It's amazing how people, with a science background end up in business, and sometimes vice versa. There's managing the business and keeping it growing, because if you're not growing, you're dying.
Right.
So, you got to keep the ball rolling. So a lot of my time is spent on business development.
How many MDs do you have on staff?
Off the top of my head, probably 15. So most of the clinics are staffed with what we call mid-levels or physician extenders, which are physician assistants and nurse practitioners. For the preponderance of what we do is primary care, and we have a network of referral sources. There's a supervising physician actively involved for the PAs, and there's a collaborative physician with each nurse practitioner. But it just depends upon the size of the company, the number of people that you have.
When we come back from break, I'm going to ask you this question. What would you do if you had 2 additional hours every day? If you could apply it to your business, what would you do with 2 additional hours every day, 5 days a week? Where would you go with it? And we'll see where your disruptive brain would place those 2 hours and how you'd create something new and different. You're listening to What's Working. I'm Cam Marston. In the studio, Mike Molyneaux, President and CEO of Symbol Health Solutions. We'll be right back after this. What's Working is brought to you by the Alabama Center for Real Estate at the University of Alabama. This is Cam Marston. The Keith family's provided service to my heating and cooling system since my family and I moved into our home 12 years ago. And today, Keith Air Conditioning offers 0% financing for up to 60 months on new installations, making a new heating or cooling system for your home even easier to come by. Give them a call or find them online and let them come work their magic. Keith and Carrier. Turn to the experts.
This is Bill Wasden, labor and employment attorney at Burr and Foreman. With offices across Alabama, our attorneys are keenly aware of employment situations in a state with under 3% unemployment. Employers have faced many obstacles over the last 2 years, and new processes and policies must be in place to ensure you're setting clear expectations for your employees. We've created a list of the top 5 legal and operating issues facing employers in 2022 that will, ultimately, ensure your company is prepared for a data breach, the Great Resignation, new presidential executive orders, or potential overtime rule changes. Reach out to me at bwasden@burr.com, that's BURR.com, or my partner Katie Willis, kwillis@burr.com for this information. Burr attorneys are here to help you with your labor and employment law needs.
No representation is made that the quality of the legal services to be performed is greater than the quality of legal services performed by other lawyers. In the studio today, Mike Molyneaux with me. He's the president and CEO of Symbol Health Solution. You're listening to What's Working. I'm Cam Marston. What's Working is brought to you by the Alabama Center for Real Estate, housed in the Culverhouse College of Business, all housed at the University of Alabama. If you're just joining us, Mike is the president and CEO of Symbol Health Solutions. They work with organizations with self-funded health care. They are a disruptive model, and I love that term. And prior to the break, I said, Mike, I'm going to ask you this question. If you had 2 additional hours every day to work on your business, what would it be? You've been given a minute and a half maybe to think about this now, Mike. What's the answer?
Well, adding 2 hours would probably bump me up to about 14 hours a day. But if I did spend another 2 hours, it would probably be ways to make Symbol a better place to work for my employees.
Oh, you'd work internally on those 2 hours.
I'd work internally on those 2 hours. because I firmly believe that you really have sort of one chance when a patient walks in the door. If they don't have a positive impression, if you didn't make an immediate connection, then you've lost that patient. They won't come back. They'll agonize through the visit, and that'd be the last time because they didn't like the attitude. I want my employees to be happy. I want them to feel satisfied. I want them to grow professionally and figure out ways to make that happen. And it's difficult these days, because employees want to. There's a lot of course, clinicians cannot work from home.
Right.
Well, actually, I take that back. I mean, they can some because there's virtual health visits, which has really grown with us since COVID. There's a lot of, but there's I'm a firm believer in you've got to get your hands on the patient. You've got to see them in person. There's some things you can take care of with a televisit, but I think it's very limited. So I want them to have the tools that they need, and I want them to be happy where they work, and I want lifers. I want people to work for me for life. When I sold TMS after 22 years, I had the first employee that I ever hired. I was giving 5, 10, 15, and 20-year sabbaticals to keep people working for you because they are you, and you want them to be loyal, and so you got to show loyal to them. And that may sound a little corny, but that's actually what I probably would do. And sometimes you just get caught up in the day.
Yeah.
And but that probably would have some of it.
So if I understand you would work internally on the morale of the organization, the culture of the organization, because that culture is transferred to that patient as he or she comes through that door. A happy physician's assistant who's really enjoying his or her job and feels like their career is fruitful and growing will transfer that feeling to the patient, and the patient will come in and leave with a good, healthy, optimistic attitude. Is that what you're saying?
You said that so much better than I. That's exactly what I'm saying.
Well,
that is exactly what I was trying to say.
So much of your bio reads and your website reads about science-based and evidence-based, and you mentioned that a moment ago. Is there evidence-based research that suggests that physician's assistants, hypothetically, influence on the patient? Is there science to say that culture drives that interaction?
If there's not, we're not doing it. I mean, there are numerous studies with hundreds of thousands of patient subjects, double-blind studies, that have shown that lifestyle intervention along with disease management of chronic conditions, those who underwent lifestyle intervention had a 50% chance of preventing a cardiovascular event later. And so what I mean by evidence-based, here's a very good example. I had a salesman come in to see me one day, and there was a gentleman with him. And I didn't know who the gentleman was, and the person who I met with, it was a medical equipment company rep, and there was this guy with him, and the whole time he has a toothpick, and he had I thought it was like a bottle of toothpicks in his hand, and he had but he had an actual toothpick in the other hand. Every once in a while, he put it up to his. I'm thinking, man, this guy. So we were finished. And then they were getting ready to leave, and the guy's name was George. And I said, George. I said, so what's up with the toothpicks? He goes, well, these are nicotine lace, cinnamon flavored toothpicks, and they're wonderful. They will, it tastes for smoking cessation. You need to start putting these in your clinic. It's much cheaper than the patch. It takes care of the hand-to-mouth thing that has to do with smoking. And we have people, they're FDA approved, and we have people beating the doors down for them. And I said, that's the coolest thing I think I've ever seen. It'll lease them off. So I had our chief medical officer check into it. And we could not find a single study that was published that showed the efficacy of a nicotine nicotine laced cinnamon flavored toothpicks,
right.
And in spite of us having customers that wanted them, we would not stock them.
So you rely on the science.
Absolutely.
You're a big science guy.
Absolutely.
Yeah. Well, I think that's interesting that you would put the focus internally to develop that, to transfer that attitude to the patient. Do you have evidence that says these chronic disease people, and I'd love to talk to you about how your research on that or how your work on that has been effective or not. Someone walks into the clinic with a chronic disease, and with the right connection with the physician's assistant, again, using that one hypothetically, they are more willing to address the symptoms of their chronic disease versus a poor connection with the physician's assistants. They're going to go back to the previous behaviors. In other words, that work and the culture inside is going to transfer to eliminating that chronic disease.
So if the clinic's on site, say you have high blood pressure, but you don't like going to the doctor, and you're working in a shipyard and you don't have time for it, and you're tired when you get off, and I'm not going to the doctor. I'm a 52-year-old male, and I can take care of myself. But if that clinic is on site, your employer allows you to go to the clinic on the clock. You can get your medications there for free. You have a health coach, a personal health coach who knows you. You can get your health coaching free. As a matter of fact, your employer will incentivize you. Sometimes, mostly, they'll give you a discount on your premium if you go to these health coaching sessions. So if all those things are in place, okay, he's much more likely to be treated. Mm-hmm. So it's very effective. It's amazing how effective it is.
And do you see more of that coming? Are the companies that are contracting with you saying, help us address the chronic diseases? Is this environment that we're describing here on the rise?
I think so. They don't ask us to help them manage their chronic diseases. They say, help us be able to provide affordable health care insurance for our employees. And if you have a program that you can show us that you've done this, there's a book called Zero Trend, and so if you can keep the health trend of their spend. Last year, I think the healthcare spend was up 4.9%. I think nationwide. If I can get that trend, the trend for the company at zero, okay. And that's a home run. If I can get them where, and we have cases where they're spending a lot less than what they were spending the prior year, even now for some customers 10 years ago. There's a huge if it's 5% national trend, and I've got them 2% below what they spent the year before. I mean, it's like 7%. If you're talking about a publicly traded company, every time I save them $1, that could be $19 to their bottom line.
Yeah.
So there's a lot of different reasons that.
We're about to wrap up.
Great.
What is your passion? What is the best news you can get from your company any given day? Is it a new sale? Is it a
renewal? A
renewal? It's not someone calling you and say, "Hey, we saved the money that you told us we would."
Well, they wouldn't renew you if you didn't. So renewal, but you know what? Really, and that's great. But I get more personal satisfaction from a patient who will write me a letter about a positive interaction that they had at one of our clinics, or a person's life that we may have said. There's an amazing number of people that we identify who have underlying diseases that never even knew it.
Yeah. Awesome. Mike, I appreciate what you're doing. Mike, again, the president and the CEO of Symbol Health Solutions. Mike, what's the website real quick?
Symbolhealth.com.
Symbolhealth.com if you want to know more. Based in the Mobile area with presence all over the state of Alabama and soon to move into Tennessee. Thank you, Mike.
Thank you, Cam, for having me.
We'll be back after this break with the 5th segment. You're listening to What's Working. I'm Cam Marston. What's Working is brought to you by the Alabama Center for Real Estate, housed in the Culver House College of Business, all housed at the University of Alabama.
They say consistency is the key to success. They weren't wrong. So how about grabbing a beer that's consistently smooth, consistently refreshing, and consistently light? you might just find that the road to success can be pretty enjoyable. Michelob Ultra, the perfect balance of taste and refreshment, and only 2.6 carbs and 95 calories. It's only worth it if you enjoy it. Enjoy responsibly. Anheuser-Busch Michelob Ultra Light Beer, St. Louis, Missouri.
Hey, this is Chuck Thus. When I'm not hosting chart-topping podcast Warriors Unmasked or coaching athletes to show up as the best version of themselves, I'm listening to What's Working with Cam Marston. Now back to the show.
Mike Molyneaux's got a tiger by the tail. I got the distinct feeling that his company, Symbol Health, is just going to continue to grow and explode. It's wonderful to hear stories like his, and I'm grateful for his time that he spent. We're back, obviously. We're in segment 5 where we wrap up the show. You're listening to What's Working. I'm Cam Marston. What's Working is brought to you by the Alabama Center for Real Estate, housed in the Culverhouse College of Business, all housed at the University of Alabama. Yeah, self-funded healthcare. Got to have a kind of a profile of the organization that can do this type of thing. And when they do it and they want to save even more money, they give call to Symbol. Mike is a disruptor. He has the unique ability to identify niches, as I said in the opening segment, and figure out where there's a hole. And it's something that it's a talent, a skill that I sure wish I had. And I sure wish I had the ability to marshal the forces necessary to fill the niche. I've learned about myself that this is not a talent of mine thus far in my life. Maybe something will happen someday and I can identify a niche and work to fill it. But Mike seems to have that capability. And now on his second go around of creating another startup where the niche is being filled. And it's an admirable thing. There seem to be people in our society who have a great ability to identify where a market needs to be and where no one is moving to fill it. And again, I admire him, and I wish it was something that I could do for myself. I realized in time that it's not something that I do very well for myself, and I need to stick with the knitting, which largely is taking other people's ideas and repackaging them in such a way that my clients can best understand them and act on them. I've got the seminar business where I hire researchers to do the research that gives me the content that I then repackage and am able to explain to my clients in such a way that they're able to utilize these types of things. Anyway, Mike, thank you again for your time. Best wishes. You've got a fan in the show, and I wish the best for you. Folks, it's time to kind of recap what we got going on around here. And if you're interested in following us and staying in touch with what we're developing and show ideas and guest types that we're looking for, I encourage you to follow me on social media. You can find me at Cam Marston. A couple of the social media sites will say Cam Marston, then the numeral 1. We spend most of our time, as do people of my age, in the Facebook and the Instagram arena. We post to Twitter from time to time. Twitter seems to be just a fist fight all day, every day, and try to avoid that one myself. But the other two are out there, and then LinkedIn as well. Follow us, keep an eye on what we're doing, send us show ideas, give us feedback, things like that. I love it. You can find each of these podcasts at what'sworkingcam.com. Again, what'sworkingcam.com. And from there, you can go into some of the other media projects that I work on. I do these commentaries for Alabama Public Radio every Friday morning and afternoon, and you can find those there. They're kind of humorous 3-minute commentaries, 3.5-minute commentaries that are just a passion of mine. Not really revenue driven at all. Wish I could change that. But they're a passion of mine to see how well I can take 500 words and create a fun and funny story. You can find those online as well. So check us out on social media. Email me at cam@cammarston.com. That's also the website. Would love to hear what you think. Get your show ideas. The show is produced by John Thompson with Ion Digital. I feel like it might have been a few weeks since I've mentioned John appropriately. John does need to be mentioned. He does a wonderful job helping shape this show. John's got some growth ideas for what's working. I'm eager to see what he does. We'll be back with another show next week. What's Working is brought to you by the Alabama Center for Real Estate. Have a good week, everybody.